I have suffered from dry eye my entire life. I remember using eye drops and eye gels as a kid. Once I started wearing contact lenses, that became magnified dramatically. Interestingly, I was never diagnosed with dry eye. I saw my eye doctor annually, if not more frequently, because my vision is garbage. And she never said a thing, despite the fact that I reported that I felt dry. I now have access to my old records, and it is clear that my eyes were significantly dry enough to be clinically visible, but nothing was ever said to me. As with a lot of different kinds of pain, you just kind of get used to it. It was my baseline and it didn't meaningfully interfere with my life. That all changed 2 years ago this month. I developed a bad cold. I was taking Sudafed, basically around the clock. My eyes dried out basically all the way, from what I can tell, and I have not yet recovered. In December 2021, I was diagnosed by the UCSF Proctor Clinic with corneal neuropathic pain as a result of my dry eye. This has left me disabled. I'm 42. I'm otherwise in good health. As noted, I'm a wife and a mom and have a very busy career, but it has become extremely hard for me to live up to all of the obligations that those roles cause. My pain is not bad in the morning, so that's when I try to spend as much time as I can with my kids because I'm not cranky or trying to distract myself. As the day wears on, my pain becomes increasingly unbearable. By nighttime, I'm often in 6 out of 10 pain, unless I'm icing my eyes, have eye gel in them, or am asleep. That means I'm often short of patience with my kids at bedtime, which kids of the ages of 3 and 6 can sometimes cause a lack of patience regardless of your health status. Sometimes I can't even read to them, which is something that when I became a mom, I love books. I read probably a book every week and a half, and not being able to share that with them sucks. It also means that I say no to most invitations I receive for evening parties or dinners out with friends. It's partly because I'm likely to be in a room with forced air that's going to cause things to be even worse. And it's partly because I'm embarrassed. When I'm out in the evening, I'm blinking heavily. I'm trying anything I can do to get some oil onto the surface of my eyes. And it feels embarrassing to me. I have tried so many interventions. I wear scleral lenses. I'm wearing them right now. I fill them with refrigerated saline solution and autologous serum tears. I use AST 7 times a day. I use Mibo. I use Cequa. I use Tyrvaya. I use fluoromethalone. I take 300 milligrams every day of Lyrica, which causes word loss, among other fun symptoms. I have previously been on low-dose naltrexone, Lotemax, Cymbalta, amitriptyline, nortriptyline, carbamazepine, Celebrex, Trileptal, and Zedra. I have had 4 nerve blocks at the UCSF pain clinic. I've tried a ketamine infusion, which was not a pleasant experience. On nortriptyline, I gained 25 pounds over the course of 3 months and developed painful cystic acne at the age of 42. I've had some really dark moments trying to treat this condition, which resulted from my dry eye. I've read all the books, The Way Out, the Pain Management Workbook, Managing Pain Before It Manages You name it, I've read it. I try to do all the homework I possibly can. My Schirmer and my T-Butt are usually 1. My eyes are extremely dry, and the neuropathic pain on top of it is unbearable at times. When my eyes first dried out in 2021, I saw an eye doctor in the community, not at UCSF. She told me that the pain was in my head and I should seek psychiatric care. I left crying. Was it all in my head? Would anyone ever understand my condition? I didn't know that dry eye existed as a diagnosis, and I did not know that dry eye doctors existed. Finding Dr. M has helped me to feel some hope again, that this pain hopefully won't be my lived experience forever. We've done IPL, which has helped. We tried Procara. She's seen that I have meibomian gland dysfunction. They are wildly deteriorated. Not only has she helped me, but she has helped me to feel seen after I felt gaslit by a lot of the previous doctors I saw. It is possible that I live with this debilitating neuropathic pain because I wasn't seen quickly enough for my dry eye. I'm part of a Facebook group of people living with corneal neuropathic pain. There aren't many of us. Many of my peers in the group are constantly asking for recommendations for dry eye doctors where they live, and they simply don't exist. It's worth noting, in a fit of darkness here, that several of the members of my neuropathic pain group have committed suicide since I joined in 2022. Not all of them have this pain because of dry eye. A lot of them have it because of LASIK. But a lot of us started out with untreated dry eye and fell off a cliff into this disease. It's not just trigeminal neuralgia that is the suicide disease. I want to close by saying I'm okay. I'm still here. Sometimes I'm even good. I went out to dinner with my friends last night and it was lovely. I do my job, which I really enjoy. I try to meet friends usually for lunches instead of dinners when my pain is less of a burden. But there's no doubt that my life is much darker and has way less joy than before dry eye led me into this path to corneal neuropathy. Addressing the dry eye helps in a meaningful way. My T-belt was 2 last time I saw Dr. M, so that's a win. I have more good days since I met her than I had before. I will continue doing everything I can possibly manage to get my condition under control with the help of my medical team at UCSF and with Dr. M. But we need more Dr. M's out there doing this work, or I worry about both the physical and mental health of those who come after me. Thank you.
Eye health starts at the surface, but I want to add to that, it also finishes at the surface.